Okay, then we go to the laboratory diagnosis here. So, we have here the specimen collection for the staphylococcal infection since most of the infection here is wound infection. So, we can collect the specimen either by swab or by aspiration technique. So, if the wound, for example, here is superficial, so we just need to swab the edge of that. But again, if the wound here is deeper, so you need to aspirate that one. Okay, for the culture media, so we have the selective enriched media for isolation of your staph would be your blood agar plate or blood agar. That may be in the form of your SBH, sheep blood agar or blood agar plate. Then we have also here your CNA, cholestyrenolidicic acid, and your phenylethyl alcohol considered here to be as your selective culture media. Selective culture media because it will allow the growth only of your gram-positive organism but not your gram-negative organism. But in the case of your phenylethyl alcohol is not just that one is selective but also differential because again that one selective and differential because it would differentiate kasi may blood ang phenylethyl alcohol natin. So therefore, it's still able to differentiate your growth of bacteria based on their hemolytic reaction. MSA mannitol salt agar serving here as our selective and differential. Selective because it will just allow the growth of your Staphylococcus, and differential because it will differentiate your staph based on their ability to ferment your mannitol. So your Staph aureus, for example, try to ferment the mannitol, whereas other staph is not capable of fermenting the mannitol, but it were able to grow on that, making this one a selective and differential. Now we go to your cultural characteristics or the colony characteristics. Staph aureus would have your medium to large na colony, and usually that one is translucent, that one would appear to be creamy, white na colony, and that one is hemolytic, beta hemolytic. Staph epidermidis on the other hand would have your small to medium, the colony size, that one is also translucent but it would appear to be gray in color. And that one is non-hemolytic. Okay, then also we have here your Staph saprophyticus would have your larger na colony size. That one would have your yellow to orange na color ng colony, but that one is have an opaque. Pag opaque, so ano siya, hindi makakadaan ang light natin. Compare with your translucent, transparent. Pag transparent, clear, translucent, makakadaan ng light. Pag opaque, hindi makakadaan ng light. So, parang siyang turbid ang kanyang colony. Okay, so Staph saprophyticus on the other hand is also non-hemolytic. Then we go to your Staph hemolyticus and lugdunensis. Both of this one will try to produce here medium size na colony. Only that your Staph hemolyticus would have your weakly hemolytic reaction, whereas your lugdunensis would have your hemolytic reactions, beta hemolytic. Okay, now we have here the differentiation between your Micrococcus and your Staphylococcus. Okay, so both of them would have here, will get a positive result with the catalase. Differentiate your Micrococcus with Staphylococcus, then we have here your modified oxidase test, your microdase, that will give a positive result only for the Micrococcus but not with your Staphylococcus. Then with their gas requirements, so again, your Staphylococcus is facultative anaerobe and therefore able to grow in the presence of the oxygen and even in the absence of the oxygen. Your Micrococcus, on the other hand, so this one is strict aerobe and therefore able to grow only in the presence of the oxygen. In the absence of the oxygen, it dies. Another differentiation between your Micrococcus and Staphylococcus would be their antimicrobial susceptibility testing. So we have here different antibiotics with their corresponding na susceptibility test result. Okay, for the antibiotic na bacitracin, furazolidone, okay, your Staphylococcus would have resistant na result, mean to say, pag resistant, hindi effective ang ating bacitracin and your furazolidone with your Staphylococcus. But in the case of your antibiotic na lysostafine, that one would have susceptible na result ang ating staph, and therefore, this one is effective against your staph. In the case of your Micrococcus, so lysostafine, bacitracin, furazolidone, so susceptible ang ating Micrococcus, mean to say your bacitracin, furazolidone is effective against your micrococcus, but not your lysosapine. Lysosapine here would have resistant result. Okay, then we have here other tests also here, some biochemical reactions for the differentiation of our staph species. First one, we have your catalase test. So catalase test would identify the enzyme catalase. So ang ating substrate for that would be your hydrogen peroxide. Positive result would have here the bubble formation. So catalase test will give a positive result with your micrococcus, Staphylococcus, but not with your strep. Then we have your bacitacin susceptibility testing with the 0.040 unit of your antibiotic na bacitracin. Or you call it once your Taxo-A. Taxo-A is your bacitracin. Taxo-A. Okay, so our cutoff for the zone of inhibition here would be your 10 millimeter diameter. So pag sobrang laki ng zone of diameter, so mean to say that one is susceptible. Pag sobrang liit ng zone of inhibition, less than 10, so that's resistant. Mean to say, your bacteria is not inhibited by your antibiotic. So Staphylococcus here, again, this bacitracin will differentiate between your staph and your micrococcus. So again, your staph here would have a resistant result. Pag resistant, so would have here less than 10 millimeters, wala masyadong zone of inhibition. Meaning to say your bacitracin is not effective against your staph. Micrococcus, on the other hand, would have a susceptible na result, signifying here na, again, this bacitracin try to inhibit the growth of your staph, your micrococcus, I mean. Therefore, sobrang laki ng kanyang zone of inhibition, more than 10 millimeter diameter. Next, we have here your coagulase tests. So there are two types of your coagulase. We have your cell-bound or clumping factor identified by your slide method. Nasa slide yung ginagawa. And we have your extracellular or free na coagulates being done on your test tube or you call it your tube method. Okay, positive result for coagulase is clamping or coagulation. So, ang positive lang natin for coagulase would be your Staph aureus. So, lahat ng mga staph natin, other than your Staph aureus, considered to be as your coagulase negative na mga staph. Okay, then we have here your CNA, cholesterol nalidic acid, and your phenylethyl alcohol. So this is your selective media because this one will allow only the growth of your gram-positive organism like your staph, but not your gram-negative organism. So mag-grow lang dito sa CNA, and the phenylethyl alcohol natin would be your gram-positive, just like your staphylococcus. Again, your phenylethyl alcohol, meron siyang blood. So that will also help us then to differentiate this one is hemolytic or non-hemolytic or alpha, beta, or gamma. Hemolytic ang ating bacteria. Another one, we have here the enzyme Dnase. So the Dnase here would eventually try to identify the enzyme Dnase. We try to hydrolyze your DNA to your short oligonucleotide. Then you add here your 0.1, you add your 1 and hydrochloric acid, mag-clear ang medium natin, so that's positive result. So, positive result lang for the Dnase, so may Dnase lang would be your Staph aureus. Okay, then we have your MSA, so mannitol salt agar. So, this contains here 7.5% na sodium chloride, and that one contains the mannitol, and another one would have your phenol red as your indicator. So, lahat ng staff natin, so we consider here your MSA as your differential and selective. Selective siya because it try to allow the growth only of your Staphylococcus. So, lahat ng staff natin mag-grow sa MSA. But in terms of its ability to ferment the mannitol, so magiging differential ito. Your Staph aureus were able to ferment your mannitol, kaya nga it will have here the pink na colony. Ay, wait. Mali. Okay, your Staph aureus here, we're able to ferment your mannitol. It would have your yellow na colony. All the rest is negative sila, kaya it will remain red or pink. Okay, so lahat sila mag-grow, ang lahat ng staph na mag-grow sa MSA, pero ang mag-ferment lang ng mannitol na Staph aureus, producing a yellow na colony. All the rest, nag-grow sila but they have a pink na colony, signifying that they are not capable of your mannitol fermentation. Okay, another test, we have your microdase test. Again, your microdase test is your modified oxidase test. So, positive result for this one is blue-purple na color. So, ang positive result natin dito would only be in the micrococcus but not in your staphylococcus. Again, this test, oxidase test, modified oxidase test, microdase, will differentiate between your staph and your micrococcus. Being micrococcus positive, your staph is negative. Okay, next we have here your novobiocin susceptibility testing. So that's your 5 microgram na novobiocin. This is your antibiotic. So this susceptibility tests will differentiate between your Staph epidermidis and Staph saprophyticus. Ang cut-off natin, we have your 16 millimeter diameter. Pag resistant, wala masyadong zone of inhibition, so mababa, less than 16 millimeter. Pag susceptible, mean to say is being inhibited ng kanyang growth, so sobrang laki ng zone of inhibition, so that's more than 16 millimeter diameter. Staph epidermidis here would have a susceptible na result, so mean to say it would have here wider na diameter, more than 16 millimeter in diameter. Your Staph saprophyticus on the other hand is resistant sa novobiocin, so it would have here less than 16 millimeter diameter in the zone of inhibition. So we have here miscellaneous test, PYR, for identification of the enzyme pyrrolidonyl aryl amidase. Ang substrate natin, PYR, this is your pyrrolidonyl beta-naphthalinamide with the enzyme PYR that will convert that one to your L-pyrrolidone and beta-naphthalinamine. Then you add indicator your paradimethyl aminobenzaldehyde. So, positive result natin for that is your red na color. Again, this will give a positive result with your Staph epidermidis and saprophyticus only. Colorless, I think, ang negative result natin. Okay, we have here the summary differentiating between your Staph aureus, saprophyticus, and your epidermidis. Usually, kasi sila ang pinaka-clinically significant natin na species ng Staph. Okay, for your coagulase, ang magpapositive lang for both your slide and tube method will be your Staph aureus, but not your epidermidis and your saprophyticus. Ang may enzyme na Dnase is only your Staph aureus, but not your epidermidis saprophyticus. Msa fermentation, again, all of them were able to grow in the MSA. Only that, ang nagpa-ferment lang ng mannitol natin is your Staph aureus, producing a yellow na colony. All the two here, epidermidis and your saprophyticus, is not fermenting your mannitol, so it would have here na pink na colony with your MSA. But again, all of them are able to grow on that. And novobiocin susceptibility testing will differentiate your epidermidis and saprophyticus. Kasi almost na, tingnan mo. Okay, so dito na test pareho kanilang result na dalawa. And therefore, in order for us then to differentiate that one, so perform here your antimicrobial susceptibility testing with the use of your novobiocin na antibiotic. Again, your epidermidis would have here na susceptible results. So, mean to say effective ang novobiocin against your epidermidis. Resistant ang ating saprophyticus with that, so hindi siya effective ang ating novobiocin as a treatment for your saprophyticus. Okay, then we have also here some of your antimicrobial susceptibility for the emergence of your mga antibiotic resistant na strain ng mga staph natin, Staph aureus. The first one we have here, again, your Staph aureus, intrinsically, meron siyang beta-lactamase na enzyme. And therefore, this would render your Staph aureus here to be resistant against your penicillin because again, it tried to destroy the beta-lactam ring of your penicillin. So therefore, hindi talaga magiging effective ang penicillin natin sa Staph aureus. On the other hand, we could also recover here, isolate ang mga antibiotic resistant na strain ng ating mga Staph aureus because of course here, nagkaroon ng resistance, certain antibiotic because of the product of your recombination process or even primarily because of misuse of the antibiotics. Yung tipo na hindi niya tinatapos ang treatment and therefore the patient will develop here resistance against certain antibiotic. So one of that, we have your MRSA or your methicillin resistant Staph aureus. So for us then to detect if your staph is resistant to your methicillin, okay, so you can check here your nafcillin or oxacillin. So ito gamitin mo ng antibiotic. This, para perform ka ng antimicrobial susceptibility testing. So pag resistant sila dito sa nafcillin or even yung oxacillin, automatic yan na resistant nila sa methicillin. As what we have discussed, antibiotic natin, na discussion sa prelim, again, your nafcillin, oxacillin, methicillin, they belong to the same group. So by testing any of this one sa kanila, automatic na parang given na siya na magiging resistant na rin siya sa entire group of your antibiotic. Okay, the gold standard actually for the detection of your MRSA is with your PCR for detection of your MECA gene which confer resistance against your methicillin. Okay, so pwede ito sa Staph aureus, pwede din siya sa Logdonensis natin. Borsa, you could also identify or some strain would have a Borsa or borderline oxacillin-resistant Staph aureus na strain. You could also hear your vancomycin intermediate Staph aureus. You could also have vancomycin-resistant Staph aureus. Again, they could be identified by your antimicrobial susceptibility testing. Another one, we have your macrolide resistance. So this would identify your Staph aureus to be resistant to your macrolide antibiotic, which includes your erythromycin and your clindamycin. So may tinatawag tayo na sometimes Staph aureus is resistant to your erythromycin, and inducible, it also try to have resistance against your clindamycin. So para malaman natin kung talagang resistant siya for both, erythromycin, clindamycin, or resistant lang siya sa erythromycin, you perform here your D test. D test performed by your Miller-Hinton agar. Strict mo dito ang Staph aureus natin. Maglalagay ka ng dalawang antibiotic discs. One is your erythromycin. So, sa malapit sa kanya, lalagyan mo ng clindamycin. Incubate, then after overnight, to try to observe here for the flattening zone. Okay, away from your erythromycin. So, dito magkakaroon ng zone of inhibition surrounding your clindamycin. Pag ganun ang result mo, then that become, okay, ang interpretation nito is, ang Staph aureus natin is eventually, resistant with your erythromycin, then resistant din siya sa ating clindamycin. That's your inducible na resistance na natawag. It's basically because your Staph aureus were able to inherit here the gene na gene. The gene is responsible for the resistance of your Staph aureus against erythromycin, inducing also resistance against your clindamycin. But if your Staph aureus, for example, here is just only having this gene, MSRA, so ito ang gene niya na inherit or na-acquire, your Staph aureus will only be resistant to your erythromycin but not with your clindamycin. Okay, so I think that's all about our Staph aureus or Staphylococcus. Okay, thank you.